Hello everyone, welcome back. My name is Dr. Vijay Bhatia. I'm a consultant psychiatrist and have experience of working in mental health. Today we are going to talk about brain circuits and symptom dimensions in schizophrenia. In general, brain circuits in the brain, there are billions of nerve cells. Some of these nerve cells are found in certain regions and have certain functions. They produce certain kind of chemicals. They have specific genes, and they will connect with other areas in the brain through the connections. And these connections receive signals from inside and from outside. Brain in general is divided into separate regions we call lobes. There are frontal lobes, temporal lobes, occipital lobes, parietal lobes, and they all have certain functions to perform, like emotions, cognitions, attention, concentration, judgment, feelings, and they have certain regions. So brain manages, monitors, and communicates, learns from these things, and will ultimately affect the actions and behaviors and feelings. A lot of these things are already in there in the brain when we are born through the genes from the parents. We all already have nerve cells, brain lobes, and they perform certain functions. But as we keep on learning, we need to keep on making new connections and keep on developing them, learning from every experience, every sensations. They all come from outside through all the sense organs and from insides where we have regulators inside the brain. In schizophrenia, there must be some kind of problems there, either with communication, or the nerve cell doesn't have enough neurotransmitter, or the connections are linked with wrong cells. That is underlying hypothesis with the schizophrenia. One of the hypotheses is that when we are born, in the first 3 months of our conception, the brain cells migrate to different layers in the brain in order in the future they can make right connections. Sometimes these brain cells do not migrate to enough levels they have to. Therefore, in the future, wrong connections are developed. So the visual connections may be wrongly connected to certain other brain cells or regions, with the thinking, with the memory, causing some disturbance. The main neurotransmitter involved, there are a number of them, but dopamine plays a much bigger role in the hypothesis of problems in the brain circuits and therefore getting symptoms of schizophrenia. Localization of symptom domains. Now, schizophrenia, we already learned that it has some positive symptoms, some negative symptoms. There are some cognitive symptoms and affective symptoms, and also some impulse control and aggressive symptoms. Positive symptoms of schizophrenia are hypothesized to be linked with the mesolimbic system. That means the nerve cells are originating in the midbrain, and they are connecting with our limbic system, striatum, and nucleus accumbens is the main nucleus there, where the dopamine is produced in the ventral tegmental area, travels through the axons to the nucleus accumbens in the limbic area in the striatum, where there is either not enough production of dopamine, not enough traveling through the axon and releasing the dopamine in the reward system. So there might be any problem, and if that is the problem, there will be some positive symptoms of schizophrenia, like delusions and hallucinations. The other part is the negative symptom. This is to do with the mesocortical and prefrontal cortex. So this is the striatum, nucleus accumbens, reward system, but this is the frontal part of the brain which actually monitors, manages, makes judgments, pays attention, concentration, understanding, and then deciding what to do about that. So in mesocortical, again in the mesial ventral tegmental area, the neurons are traveling to the cortex, especially the frontal part. When we say frontal part, it will also include the orbital part, prefrontal areas, and dorsolateral areas. So mesocortical pathway, if these are not working properly, then there can be negative symptoms of schizophrenia, i.e. patient is not motivated, patient is not involved in socializing, interacting with other people. And obviously they interlink with the nucleus accumbens and reward system. So this one overlaps positive and negative symptoms. The other symptoms are cognitive symptoms. They are again with the dorsolateral part of the cortex, frontal lobe, prefrontal cortex. They are very much to do specifically with attention, concentration, focusing, planning, judgment. And if these are affected, obviously they're going to affect other symptoms. Affective symptoms are mainly with the amygdala, ventromedial prefrontal cortex. So this is the dorsolateral. So here it will be the medial, ventromedial. Ventral means underlying, underneath. Medial on the inner side, medial side, towards the center. Cortex. If the dopamine and the neurotransmitters and the nerve cells are not communicating with each other as they should, there will be some affective symptoms, that is mood symptom. Patient may get low in mood, they don't sleep properly, they don't feel happy, they don't get the pleasure. And although we are saying that it is dopamine, but the dopamine, other neurotransmitters play in the role of emotions like serotonin, adrenaline, noradrenaline. They are being affected. The other important domain of schizophrenia symptoms is aggressive symptoms. They are very much to do with the impulse control, and again they are very much linked with the orbitofrontal cortex, so near the orbits, if there is the eye here, and underlying this cortex is affected, and amygdala again with the affective part. Amygdala is the part of the brain where it gets the main features will be fear, emotions. They are being affected. So if person is getting threatened, they will become aggressive to defend themselves. So these are the main. So positive symptoms, negative symptoms, cognitive symptoms, affective symptoms, and aggressive symptoms. They are domains of the schizophrenia symptoms and how they relate different parts of the brain or different regions of the brain and which neurotransmitters are being affected. This is just a general view of the dopamine pathway because that is the main neurotransmitter that is hypothesized that it has a role, bigger role to play. If there is too much dopamine, there will be hallucinations and delusions, and if there is too little, then there will be a lot of negative symptoms. So there is a mismatch. There might be low in this area, there might be high in this area, or again low in this area, high in this area. So if the balance is not right, then there will be problem. Hippocampus is shown here, which is mainly to do with the memory. Substantia nigra is shown here, which produces dopamine cells, which goes to the striatum, and this is ventral tegmental area supplying to the nucleus accumbens, which is the reward system. If this dopamine and these connections are not right, and they are not producing either defect in the genes of these neurons, they are not producing enough neurotransmitter, or they are not being transmitted properly, or they are not being released properly, that is going to affect the learning as well. Again, this is just I'm highlighting again in words. Positive symptoms of schizophrenia are hypothetically modulated, that is the word, by malfunctioning mesolimbic system as we seen above. Negative symptoms are hypothetically linked to malfunctioning mesocortical. So there's a difference. This is mesolimbic and this is mesocortical circuits, and may also involve mesolimbic regions such as nucleus accumbens, which is part of the brain circuitry and thus plays a role in motivation. The nucleus accumbens may also be involved in the increased rate of substance abuse seen in patients with schizophrenia. Therefore, trying to get the reward either through smoking, drinking alcohol, taking cannabis or cocaine and other substances. Affective symptoms are associated with ventromedial prefrontal cortex. Aggressive symptoms related to impulse control are associated with abnormal information processing in the orbitofrontal cortex and amygdala. So if the person is having problem with information processing within the frontal part of the brain in the orbitofrontal cortex, then it is going to affect the amygdala, which is an organ for producing fear, emotional reactions, and patient will behave in aggressive way, in impulsive way. Cognitive symptoms are associated with problematic information processing in the dorsolateral cortex. Although there is overlap in functioning among different brain regions, understanding which brain regions may be predominantly involved in specific symptoms can aid in customization of treatment to the particular symptom profile of each individual patient with schizophrenia. For example, if the patient has more negative symptoms, that you know that the prefrontal cortex might be the main area and there might be less dopamine there. If the person is behaving too much aggressive, then the person may have some problem with the orbitofrontal part of the cortex. It might be too low dopamine that the brain is not able to process the information properly, and other neurotransmitters therefore affecting. So if we can balance this out, where to balance how much neurotransmitter should be there, then we can probably help this patient to monitor. Now remember, these are naturally occurring neurotransmitters in the brain. However, these can be affected by using some illicit substances, especially cocaine, amphetamines. And if the person is abusing these, they will imbalance, they will create the balance problem of these neurotransmitters, therefore causing some problems there and symptoms of schizophrenia, like delusions and hallucinations, can develop. Localization of brain symptoms. Now, we mentioned that there are brain areas. They have unique neurotransmitters. Certain brain areas like substantia nigra will produce dopamine. Nucleus raphe will produce serotonin, and they will project their fibers to certain brain areas, as we seen in dopamine mesolimbic system and mesocortical system. Each nerve cell has receptors. If serotonin is released by this neuron in the nucleus raphe, there will be a receptor to receive that on another neuron. And they are very specific. For dopamine, there will be dopamine receptors. For serotonin, there will be serotonin receptors. For insulin, there will be insulin receptors. For in order to get glucose into the brain cell, there will be insulin receptors, which will open the glucose receptors. So there are receptors which are like gates and which get stimulated and pass the signal from the other. And there are enzymes which actually produce the serotonin or dopamine within the nerve cell from the raw materials that we eat, like tryptophan goes into the nerve cell which produces serotonin, and tyrosine goes into the nerve cell which produces dopamine, and they are converted because the genes in those neurons will produce those conversion of tyrosine into dopamine, and in this case from tryptophan to serotonin, they have those enzymes, and genes regulate to manufacture these enzymes, regulate to manufacture these receptors. So genes will have the machinery, the template to keep on producing the receptors, to keep on producing the enzymes, so that the ultimate molecule like dopamine or serotonin is produced. There is some overlap over these with their connections, but also with some unique regional differences, and knowing this can assist the clinician in choosing medication and monitoring the effectiveness of treatment, especially when it comes to the side effects as well. This is a neuron. Dendrites receive signals from the outside world, from the blood, from the other neurons. They receive all the signals, and nucleus, as we mentioned, has the genes to produce those neurotransmitters through the proper enzymes, and neurotransmitters travel through these axons. So this nucleus here has the genes. They will produce the neurotransmitter like dopamine, which will travel through the nerve cell, through the axon, and will be released at the end nerve terminals. Any malfunctioning, either in the production or transport or release or too much release, will be affected and can cause symptoms of mental disorders. Especially in this case, we are talking about schizophrenia. Thanks for watching. If you like this video, please press the like button, share with friends, and subscribe this channel. This is a series on schizophrenia where we started with symptoms in schizophrenia, like positive symptoms, negative symptoms, and this is about the localization of brain circuits and symptom dimension in schizophrenia. There are other videos. Please subscribe the channel and watch the other videos. I'll see you in my next video.